Fighting Blindness Canada's View Point is a virtual education series that brings you the latest in vision research presented by health experts from across Canada. The webinar you're about to watch is a recording. To learn more about the research we fund and upcoming webinars and events, please visit our website at fightingblindness.ca. This Viewpoint webinar is proudly presented by Bayer and supported by AGTC, Allergan and Abbvie Company, MeiraGTx, Novartis and Roche. We'd also like to thank Accessible Media Inc., our national media partner. Everyone here should download the AMI app, which is a fabulous resource. And you can watch excellent programming, including previous Fighting Blindness Canada events. Thank you for watching. We hope you enjoy this webinar and share your thoughts with us in the comment section below.
So we have Dr. Dianne Vanstadon, who is an optometrist and a senior lecturer in optometry at the University of KwaZulu-Natal in South Africa. And her research focuses on improving eye health services, and she has contributed to eye health policy development and optometry training within the global eye health sector. And we're very lucky because Dr. Vanstadon is currently a visiting assistant professor at the University of British Columbia, Okanagan. And to start off with, because this is quite a different sort of research than the other research we've been talking about and listening to today. So I was wondering if you could just describe what your research focus is.
Absolutely. Is the mic on? Oh, perfect. Thank you. Good afternoon, everyone. My research focus is in the area of eye health equity. And what that means essentially is that every person, regardless of who they are, where they are from, should have access to the eye care services and treatments that they need. More specifically, though, I've zoned my research focus in the broad field of unmet eye care needs and understanding the factors that feed into unmet eye care needs. So what I mean by that is that there are many people all over the world, regardless of whether it's developing countries or developed countries, who need access to eye care services or treatments and are not getting them for various reasons. That could either be because they're not aware of the services are located outside of their geographic region, the services are unaffordable, and so on the one end of the spectrum, services may be available but not accessed, and on the other end of the spectrum, there are people who need it but can't get to it. So that's my real passion project in my research. Thank you.
And so sort of going off that, we in Canada know about the concept of universal health care. But we might be surprised to know that we don't have universal eye care in Canada. So could you explain a little bit what having universal eye coverage would mean and what gaps do you know that we have in Canada that need to be filled?
Thank you for that. Yes, so universal healthcare, you're all familiar with the term, as was said. Universal eye health is a component of universal healthcare, where specifically eye healthcare is made accessible to all people, at a cost they can afford and without placing financial burden on the population when it comes to accessing services. As an optometrist, I naturally would advocate for access to primary eye care, which is really routine eye exams and corrective spectacles or other sort of optical devices or aids as needed. And that's a critical first point to early diagnosis and treatment of more vision impairment causing conditions or retinal conditions like we've been talking about this afternoon. Research all over the world, has shown that early diagnosis and treatment is critical. And I'm so glad that the first speaker highlighted the importance of optometrists being the first line of screeners almost for some of these conditions and then referring patients to the necessary treatments. So from my readings and my understanding of the way the Canadian health system is structured, I understand that the different provinces also fund eye care slightly differently, and I've termed the unmet eye care needs across Canada as what I call the missing middle. For the most part, all provinces would sort of fund coverage for children up to the age of 19, and then patients over the age of 65. And for the economically active population between those age groups, there is an out-of-pocket expense, which becomes for some people a barrier to accessing services, whether that's just primary eye care services or more specialized treatments like genetic testing, as we've heard this afternoon. So that's a critical issue that must be addressed. How can we bridge the gap between the people who need the services in that missing middle and them actually getting the kind of care that they need?
And I think what's really important is when you don't have coverage in that middle part, even for individuals who might, it might not be an economic burden to go to healthcare. I know personally you sort of think, well, if it's not covered, maybe it isn't as important, and that clearly isn't the case. So it's, I feel like broadening coverage really can help the entire population.
The entire population, absolutely.
So can you think of specific concrete examples that could improve the access for Canadians, maybe in different populations, either through your own research or examples you've seen in other countries that maybe are doing things differently or better?
So through my work in various developing countries, and I must admit my focus has largely been on developing countries, much of Africa and other parts of the developing world, we realized that the first barrier is lack of awareness of care that is available. And unless we address that fundamental barrier, people being aware of the blindness causing conditions or the need for routine refractive care, that we're not going to get the other end of the service spectrum, seeing the people coming through the door. So awareness of services is critically important. Then secondly, removing barriers to access. What we've done in many parts of Africa is advocate with governments, advocate with various non-governmental organizations who do healthcare programs in these countries to establish, in my case, optometry as a profession that didn't exist in the majority of the countries in Africa. When I started doing this kind of work, I think only 12 out of 52 countries in sub-Saharan Africa had optometry as a formalized profession and had some level of training in their countries. So to start from those fundamental levels, how do we build the capacity, whether it's in the country, in the province, in the community, to create skilled personnel who can then deliver the services, and then creating awareness among the general population of the need for routine eye care. What are the common eye conditions in those countries or in those communities, and how can we work towards avoidable blindness? I'm sure you're all aware that there's such a huge burden of preventable blindness or avoidable blindness in the world, and we'd rather sort of prevent people from losing their sight, or at least losing a large portion of their sight and maintaining the majority of their independence, than to treat it at a late stage or at an end stage where it becomes a rehabilitative intervention, which is often more expensive than primary care intervention.
That's actually a really interesting term, preventable blindness or avoidable blindness. I was wondering if you could just tell us a little bit more about what you mean by that.
Yes, so essentially, as the name would suggest, literature suggests that 75 to 80% of people who go blind need not have lost their sight, or who developed severe visual impairment need not have gotten to that point if there was early intervention and treatment available to those people. And so that's what the term avoidable blindness or preventable blindness, often used interchangeably, really means. How can we prevent people from getting to severe visual impairment and blindness? And it really starts with access to care on the various levels: availability, affordability, and also what is appropriate for those communities and contexts.
I feel like this is coming full circle to the first panel of the day, where we were talking about the age-related eye conditions like glaucoma, age-related macular degeneration, so making sure that there's early diagnosis and then access to that treatment.
Absolutely. Because if I could just add on to that point, as you all know, that many of these conditions are asymptomatic until rather late, in the condition. And so, just simply going for a routine eye test to get your spectacles updated and early signs of change at the back of the eye, or whatever the case might be, are a critical first step to then saying, I suspect it may be A, B, C, or D. Let's get you in, let's get the treatments going so that we can preserve the vision for as long as possible.
Thank you, Dr. Van Staden. I have to say, so when I joined Fighting Blindness Canada 2 years ago, it had been 7 or 8 years since I'd last had an eye appointment because I was living in the UK before and I didn't really know the eye care system. And joining Fighting Blindness Canada, I was like, oh, I need to go get my eyes checked immediately. This is terrible.
Good stuff, Larissa.
Yes. So Doug, I'm going to move over to you. So everybody probably in the audience knows Doug Earle. He's the president and CEO of Fighting Blindness Canada, and a really great advocate for the vision loss cause in Canada, I would say. So we're really excited to have you talk a little bit more about sort of what drives your passion in this area.
Sure. Well, as many of you that I've had an opportunity to speak with, I've dedicated most of my life to healthcare and raising funds to support research. And when I was working at University Health Network, one of the programs I was raising money for was ophthalmology. And it was actually, it was there I learned that the eye is where research is, because it for so many reasons, the eye is being chosen to where treatment could happen, where it could be proven, and then they would roll it out to other parts of our body that could also benefit from these treatments. So gene therapy, it's no surprise to me that gene therapy was the first targeted gene therapy treatment. It was in the eye that was approved by Health Canada because it is a great field, a great area, organ of the body that could be there. So for me, getting involved in eye care and funding of research was really critical. Then I discovered that we're probably the most, for all the diseases I've worked in, cancer, diabetes, hemophilia, arthritis, I must say that healthcare is the most Byzantine, and many of you have shared your stories of you trying to navigate eye care in this country. And so that became, as I took on this role, I was hearing it far too often. And so that's been a part of, for Fighting Blindness Canada, we've been funding research for 40 years. We've invested over $40 million. We've had over 600 discoveries from those investments. But if you can't get access to those treatments, if you can't navigate the health system to get access to those treatments, why are we doing it? And so that's why our work in accessing healthcare, our advocacy, has been a focus, a part of our new mandate with our new strategic plan.
Yeah, that was a great overview of your passion, Doug. So since you've started, what are some of the key issues that you think are really key for both the vision loss community or that Fighting Blindness Canada is working to advocate for? Sure.
So I first off, when I joined back in 2018, the health, our population health information about the impact of eye care was decades old. And when you're having conversations with government, if you're trying to set up how eye care will be delivered in Vancouver, you need to have your stats. So thankfully, the board and our donors agreed, and we were able to fund the Inherited Retinal Disease Counts, IRD count study. And just around the time that we were in conversation about Luxturna and trying to get a recommendation that it be publicly funded, we were able to complete the study. And so for the first time in Canada, we identified that there was just around 21,000 people living with inherited disease, and that the social economic impact of these diseases, these inherited retinal diseases, to Canada is $1.6 billion. When government hears that, they listen. Before, we couldn't state that. We couldn't share the story that the majority of those costs, 1 billion of that 1.6, is actually the impact on families, and that the services were non-existent. We couldn't tell the story that is the journey that people experience as their progression happens with their disease, where there's employment impact, there's accessing services sooner than their sighted peers. And that's what this study did. So having that population health data was critical. And then it led to, it's a larger project to do it for all blinding eye diseases. So we engaged with our vision partners, the optometrists, the ophthalmologists, and the Canadian Council of the Blind and Fighting Blindness Canada did a cost of vision loss and blindness study in Canada based on 2019 data, and comparing it to the last time that this was done in 2007. And we were able to show that the number of people living with uncorrectable vision loss doubled. But the actual direct cost to the healthcare system remained the same. And we looked a little bit under the hood and found that there were really two drivers. Innovative medicine had actually increased by $1 billion. The total cost was the same, but in that category, it had gone up by $1 billion. What was the impact of that? The fact that people were not progressing from mild to moderate to severe vision loss, severe being blindness, was the result of that investment by the health system in giving you access to these new treatments, anti-VEGFs, the glaucoma surgeries, the other treatments. It's part of our argument why they should be funding Luxturna, because if we can get access to the treatment, then it will transform people's lives. So we found that there was over 8 million Canadians, 1 in 5. That number was 5.5 million last time. So it's gone up dramatically, and yet government hasn't moved forward with changing health policies. And so these type of population health, the health economics, are critical to being able to talk to policymakers, to talk to the people who make decisions about how your health care is delivered here in Vancouver and Victoria, in the Okanagan. And that's why it's so critical. And thankfully, Fighting Blindness Canada was able to work with our partners to get this study done, and thank our funding partners to make it happen. The other, and then what do we do with that type of information? Well, that's what these two websites are on my screen, and I would ask everyone to pull out their phone and go to these two screens if you haven't already done so at stopvisionloss.ca. Because that is the campaign that the Fighting Blindness Canada and the Canadian Council of the Blind have partnered to launch. We're calling on the federal government to develop the vision health plan for Canada that they've been promising 5 times since 2003. And they have not fulfilled it. They've made these commitments. Chrétien's government, the Harper government, the Trudeau government have made these commitments on the world stage. Make them all proud, make them look good. But when it gets right down to brass tacks here in Canada, it's not done. And what does that mean? That's why we're saying sign the petition, make sure your voice is heard through stopvisionloss.ca. But what does it mean? So the UK in 2020 had a pandemic. So did we. Their population is double the size of ours. And when we looked at our study about the impact of COVID on eye health, using the 2019 data that as a comparison, we found that in the UK, and compared to the study that was done at the UK by Specsavers, that they found that just roughly about 15,000 anti-VEGF eye injections did not happen in the UK compared to the year before, 2019. In Canada, that number was almost 70,000, despite the fact that we have half the population. The difference, they have a vision health plan in the UK, And these injections were identified as a part of care that had to continue despite the pandemic. In Canada, it was hit and miss. Some parts of the country did respond. Some parts of the country did not. And it took months before we got back to regular eye injections. And you know, when you don't have one of those injections, it's only a matter of weeks before you start having cell death again. So this is why it's so important. And the other is, as Dianne mentioned, the fact that early diagnosis of these eye conditions, the AMD, glaucoma, diabetic retinopathy, can make a big difference in people's outcomes because research has delivered treatments for 3 out of 4 Canadians. If you're diagnosed early enough and you have access to treatment, that we can stabilize your sight. That's why we didn't see the progression. But you know, despite the fact that that the number of Canadians living with an eye disease, blind eye disease, has doubled, the number of publicly funded cataracts surgeries has remained basically the same. It went up 5,000 in a decade. So these are facts that we've identified, and we are moving forward, and that's what we're trying to use stopvisionloss.ca to be able to say to government when we go in a few, well, I guess it's next week is May. Boy, time flies. It's May is Vision Month in Canada, Vision Health Month, and a coalition of medical professionals, the optometrists, the ophthalmologists, the opticians, occupational therapists, and organizations like ours, Diabetes Canada, CNIB, the Canadian Council of the Blind, ourselves, Fighting Blindness Canada, are going to meet with MPs, and we're going to say with this petition, Canadians see this as an important issue. We want to be heard, and we want you to fulfill your promise that you've made to the world and Canadians almost 20 years ago. And as late as 10 months ago at the United Nations, when Canada voted for the World's Health Organization's Eye Care for Everybody, they made that commitment again to have that Vision Health Plan.
Thank you, Doug. So I think you passionately said why we need to sign this petition. So maybe not when Doug Purdy's talking, but right afterwards. You guys can go to those websites and please sign this petition, show the government why you think vision health is important for yourself, for your family.
Can I just add one more thing about approved Luxturna, since it's up there on the screen too, and then the other Doug can speak. I just wanted to say, we were thankful to the community who filled out our quality of life study. We used it in advocating on your behalf to why Luxturna should be the first treatment funded, the first gene therapy publicly funded. And in a matter of weeks, over 600 members of the community stood up, made sure their voice was heard, and we delivered a very robust report to the people that make the recommendation. That was almost 510 days ago that Luxturna was approved. And it took a year. It worked very well on the federal level. When it hit the provinces, things slowed down to a snail's pace. Health Canada did their review in the time frame they said. The two regulators in a month gave the recommendation that it be publicly funded. And then it went over to the provincial governments, and they took a year and a lot of hard work. And some people may have filled out this email or went to the website, gave their email, and your premier, your health minister, and your MLA received an email about why getting Luxturna publicly funded was important to get the negotiations started. It took a year. November 25th, we heard the news. The provincial governments agreed that, yes, they would try to negotiate access to this treatment. So we changed up the email. If you did it once, please do it again. Do it the second time. The email is about accelerating that negotiation. The body that does this said they try to have the negotiations wrapped up in 4 months. Well, that passed in March. It was 4 months. So now you'll be hearing a lot more about approvedluxturna.ca, and encourage you to fill out that as well, to send an email to the Premier here, to the Health Minister and to your MLA, because if we need this treatment negotiated, we need public access to it, and the Canadians that are waiting need to have their sight restored, and we need to set the precedent. So all those trials that Dr. Simpson talked about, that the panel just talked about, when they're ready to bring that treatment to Canada, that it gets publicly funded as well. And if we have the precedent, it makes it so much easier to get the next treatment and the one after that and the one after that publicly funded. So please, 2 websites for you to get your voice to be heard.
Thank you, Doug. And finally, moving on to our final panelist, Doug Purdy. So Doug is a Vancouver resident who is a wonderful ambassador for FBC. Doug has AMD and glaucoma, and we just wanted to hear a little bit about Doug's experience both with diagnosis and treatment. So just as a sort of introduction to yourself, I know, as I mentioned, you have wet AMD and glaucoma. Could you tell us a little bit about your diagnosis?
Sure. Going from the global to the national and provincial to the personal. Again, my name is Doug Purdy. I've lived in Vancouver since 1964 when I moved out from Spring Hill, Nova Scotia. My first introduction to eye care was when I was 8. I fainted at a ball game with my father. Was taken to an ophthalmologist through a referral from my doctor, and was determined to have astigmatism and nearsightedness. So I was, from the age of 8, had eyeglasses and eye problems. Fast forward to my mid-50s, by that time I had moved out here, and I had again identified a doctor who referred me to an ophthalmologist because I was beginning to have eyesight problems. And it was detected that I had age-related macular degeneration. And he handed me a booklet that described what age-related macular degeneration was, and an ancillary grid, my savior, which I put beside my bedside table, and every night referred to it. I had a very active development management company at the time, and I did with my partner, a lot of work out in the community in various municipalities with major projects. And one day was driving out to a site, getting onto the highway, and as I was going, the curve in the line started to do this. So it became very wavy. And I knew exactly what was going on because of the literature I was given, because of the ancillary grid. And I finished my meeting, of course. I went out to do my meeting and came back, made an appointment, and it was determined that my dry macular degeneration had converted to wet and was referred to a retina specialist, and at that time was then given, just as the province was approving it, Avastin. And since then, I've graduated from drug to drug, from Avastin to Lucentis to Eylea. Had an allergic reaction to Eylea. Now I'm back to Avastin. So that was a bit of my journey.
Thank you. I think That's a really great sort of example of what Dr. Van Staden was talking about preventable blindness. So if you hadn't sort of been savvy enough to think, oh, something is wrong when I'm seeing this wave, it could have progressed much further. So that's
Absolutely. I was so fortunate to be able to have the information, to have access, which is really critical, to the services, and my timing was perfect insofar as the drug being available. If it had been 10 years earlier and the drug was not available, I would be probably sitting here more likely with a white cane than being sighted. Now, if I close this eye, of course, I have blocks of vision because that's my worst eye. If I close this eye, my vision is much better. So I'm a bit of a cyclops.
So it really sounds like the innovative treatments have really helped prevent further progression.
And again, and there's so much research going on today. There's so much new products evolving. And I am so thankful for the work of Fighting Blindness Canada, all of the researchers that are working in the field, that are evolving, and all of the genetic work where we're finding more and more genes that are identifying more and more disorders. Without that, people would still be, if you will, literally in the dark ages insofar as the identification of issues. I've learned more about the whole range of eye disorders and diseases than I ever could have imagined, having been immersed both in terms of treatment and in terms of my association with Fighting Blindness Canada, to understand how the breadth of eye disease and disorders. And it is really disappointing to hear politicians promise but not deliver.
Thank you. I'm aware of time, and I know it's a Sunday afternoon, so I think I might keep it there. I feel like you actually captured sort of what this whole day was about education, about learning more, and about hopefully encouraging you to ask more questions, and if you feel inspired to tell the government to support more vision research, vision care. So I want to thank this panel in particular, but all of our speakers who volunteered their time today to come here and to share their expertise with us. I know I've had a wonderful experience today.